Okay, hello everyone. Welcome to today's webinar. I'm with Dr. Curt and we're going to do a short webinar on an interesting topic. We want to cover the topic of constipation and gut problems. So it's something a little bit perhaps embarrassing for people to talk about the topic, but it's actually something that affects a lot of people. And so I just wanted to give you a bit of stats about it before we get into it. But if we're going to talk about the topic of constipation, the statistics say that 1 in 5 over the age of 30 at some point will suffer from this at some point in their life, and that it is the most common digestive complaint in the United States, outnumbering all other chronic digestive conditions. The number of people suffering from constipation is on the rise. And there's a recent survey showing that 16% of Americans and a third of all those older than the age of 60 suffer from chronic constipation. Each year, there is over 700,000 emergency visits to the hospital for constipation. The number of people admitted to hospital has doubled since 1997, according to statistics from statnew.com. So it's a pretty big problem. And there's some pretty amazing stories. Actually, I might start off with this story, and then I'm going to let Curt talk on it because I'm sure he has lots of experience with patients. But this particular story is about constipation and cancer, and it may not actually be that uncommon. And it illustrates that the costs of constipation problems may be much more than just monetary. So basically, it says that this is a story, I think it's actually a true story. The name's obviously been changed, but a gentleman, Larry, had widespread cancer, but this was not his cause of death, his sudden cause of death. And Larry was obviously certainly not ready to die. And, his family and friends could see it in his eyes. He was suffering from intense belly pain. And when he did die, even though Larry's death was listed as a proliferated colon, which resulted in bloodstream poisoning from bacteria, his actual cause of death was constipation. So that's a pretty big deal, and it's a pretty shocking story, but I just thought it's a good topic to talk about how people can address this because it affects so many people. So Curt, what do you think of that story? Because you've experienced things like that before. Okay, is there?
I'm here. Can you hear me all right?
I can hear you now. You just cut out for a second.
Yeah. Katie, when you were going over the statistics, isn't that amazing?
Yeah, it's pretty high. And I mean, there's some real, common reasons for it, but there's, so many other things that affect it too, right? Why that happens to people.
Yeah. I'm going to share a couple things. Number one, when we're looking at the digestive system, why is it so important to get your gut working right? The body does almost like a triage, right? We know what triage is. That's where doctors decide, okay, what's the most important thing to go after first? And your body, your innate intelligence, the healing system within your body, it tries to figure out what's the most important thing to go after first. And if you've got brain cancer and you've got digestive problems, it's going to go after the digestive problems first. Did you know that?
No, wow. So if somebody's got chronic constipation and they've got cancer, and so the constipation is obviously causing digestion problems because food's not getting through. So what you're saying is the body's going to go to repair and try and do work on the gut and forget about the cancer elsewhere.
Yes, the body is going to go after the digestive system problems first, because if you get a really bad infection in the digestive system, a friend of mine, he just passed away here a couple months ago. Basically within days they found this infection and boom, he was gone.
Right. Wow.
And because the digestive system is that important, your immune system, your stem cells, everything are going to go after that first before they go after anything else. So if it's that important for your body, shouldn't that be the most important thing for you to think about as well?
Yeah, it's really interesting. This is a really interesting topic because I've really redirected my attention in the last couple of weeks to the gut and digestion. Because, of course, how well your digestion is working will also determine how many vitamins and minerals you're absorbing. So you really want to have the gut working properly. And I know, Curt, we were talking about this, but, there was, I purchased a report from Harvard and they were talking about that 90% of your serotonin, which controls your sleep and your mood, comes from the bacteria in your gut. So if your digestion and your gut's not working properly, you're not going to be in a good mood and your whole body's not going to be functioning. And I know you had some more information to add to that as well.
You bet. Yeah, when you're looking at serotonin back in 1999, so 20 years ago, when I first started working with serotonin in my clinic and when I was working with patients that were serotonin deficient. Can you hear me all right?
Yeah. Keep going. That was serotonin deficient. Yep.
Yeah. When I was working with serotonin deficient patients, that's when I learned that all the serotonin, 90% of serotonin is stored around the gut. So if you have digestive problems, you're going to have low serotonin levels. And serotonin is considered the master neurotransmitter, the master chemical that controls mood. And so if you're having a bad day, you might want to start thinking, is it a gut problem?
Right.
If you're having anxiety, is it a gut problem? And then another neurotransmitter called GABA, GABA, gamma butyric acid, is another neurotransmitter that's stored around the gut too, and that's also a mood enhancer. And so we have to look closely at if the gut isn't working right, you're not going to have good moods. You're going to feel crappy, right? That's a good word to use in this particular instance, right?
Yeah, absolutely. Yeah, crappy. Yeah, yeah.
Right. So when somebody says they're feeling crappy, you can say, well, I might know why. But I had a patient. I'll go back to about that time. Actually, it was 2006. After I learned about the neurotransmitters, one of my patients, Deb, she came in and she was having these migraine headaches. They were just devastating. She had to go to the hospital 3 to 4 times a week and get shots of painkillers because the headaches were so bad. She'd miss work 3 days a week. I was surprised the doctor she worked for didn't can her because, she could never go to work. Anyhow, I sat down when I did the initial consultation with her and I said, let me just ask you a question. I know it's not going to make a lot of sense, but I said, how often do you poop? How often do you have bowel movements? And she kind of laughed and she said, the doctor said it's normal for me. And I said, well, what's the answer? And she was going to the bathroom 2 times a week or 2 times a month.
2 times a month.
2 times a month.
Well, I've got a photo I want to share with our viewers that I've got here. And this actually leads on to what Curt's talking about. Let me just bring this up here for a second. Where are we? Hang on a minute. Because if you're going to the toilet only 2 times a month, then this is likely to be the case. So you can see these x-rays. You can actually find them on Google Images. But let's see if I can zoom in here just so people can see a bit better. Yeah, here we go. Okay, so we can see, oh, crap.
Would you say crap? Yep, that's what it is.
Yeah, that was, sorry, everyone. Okay.
Poop. Yep.
Oh, poop. Okay, this will do. Hang on. I'm just trying to bring it up. Okay, hang on. Sorry. It's really hard to navigate when you're talking at the same time. Okay. So you can see this x-ray. And so see the dark spots here? Like here's the rib cage here. And then you've got the hips. This is actually a child, by the way, a 5-year-old. And then you've got these dark circles here, which is really right up at the rib cage, right close to it, just under the ribs. And that's waste matter.
Impacted fecal material, yeah.
Yeah, impacted. So this is actually not an uncommon thing. you know, the thing is, Curt, when you said about this lady going to the toilet twice a month, I mean, you could even be going to the toilet every day, but just a little bit, and you could still have this problem going on. So,
yeah, they say having 2 normal bowel movements a day is considered normal, and 2 normal bowel movements, that would be like like toothpaste type. I know you're not grabbing it and making sure it feels like toothpaste, but yeah, like that kind of consistency. It's not liquidy, it's not hard balls, things like that. It's got that pasty look to it.
Yeah.
And twice a day is considered normal. If you're not going twice a day, you've got something wrong with you.
Yeah, so it's something. So I guess we'll talk about how, you know, one could start addressing that. But before I just wanted to
let me tell you what I did with Debbie first before we jump into changing that, because while it's on my mind, is that so I had her change her diet. She went to an anti-inflammatory type diet with getting rid of wheat and getting rid of dairy and things like that. And immediately she started going to the bathroom every day and having normal bowel movements, and her migraine headaches were gone.
Yeah. So, yeah. And so that's really interesting, Curt, and I'm glad you talked about that story because, you know, actually may not be the, you know, just because you've got constipation doesn't mean it's your fault, because, you know, if you do, and I've read up on this and it's exactly what you just mentioned, if you've got a food intolerance and your body cannot digest something, say your body's got problems digesting dairy or it's got problems digesting gluten, then those, and you continue to eat those foods, you could end up suffering constipation from them if the body's not digesting them. And in the same vein, you could have the opposite of constipation, diarrhea. But certainly eating foods that do not agree with you can cause all sorts of digestive problems and could kick off this whole process.
Yeah. Well, and when you're talking about diarrhea or loose stools, I mean, think about it. Your body's going to be trying to purge the system. And so what's going to happen is that you're going to go from being constipated to being a salad shooter, back to constipation, back to being a salad shooter. And it's going to go in and out like that. But it still means that you're constipated. So you can have loose stools and really still have the diagnosis of being constipated.
Yeah. So the treatment of constipation actually runs into the billions of dollars with over-the-counter laxatives. There is actually a test that you can do if somebody wanted to check themselves. It's a medical test called Rome 5 criteria for diagnoses. I will post it on the group for anyone who wants to read it. And it goes through and it just says if you have 2 or more of the following symptoms, and you can read what the symptoms are, and you can sort of judge for yourself. But, you know, I also want to say here that, you know, I'm not a doctor, Curt is, and so this is not medical advice, and that if you do have a concern and you are worried about your digestion or bowel habits, then you should definitely visit your doctor. So I just wanted to put that in there. But, you know, if we talk about things, the main things that will help move things along, firstly, you would want to identify those food intolerances because, like I said, they could be causing, triggering the problems there. So it would be important to eliminate those foods. But the next most important thing, of course, is fiber, right, Curt?
That's right.
Yeah. So, you know, and fiber comes in 2 types. You've got the soluble fiber, which dissolves in water, and then insoluble fiber, which passes through almost undigested. So soluble fiber will come from, you know, your fruits and some veggies. And then the insoluble fiber is more like the bran and stuff that sort of goes through as is. It's a lot more harsh. The actual recommended intake for fiber each day is 25 to 30 grams of fiber. And most people are definitely not getting that amount of fiber. If you turn over a packet, if you're eating some packaged food or tinned or canned, have a look at the grams of fiber in the food. Sometimes they don't even list it. Do you know that on a nutritional panel, when they have to list the carbohydrate, protein, and fats, they don't have to list the fiber. Fiber's excluded, which is a big problem because I don't know why they do that. So actually, sometimes you can't even tell how much. But you can take a guess that if it's been processed, it probably has very little amount of fiber. And a lot of your fiber is going to come from, you know, your whole grains, your fruits, your vegetables, and those sorts of things, nuts, legumes.
Yeah.
So medications, yeah, go on.
Oh, I was just going to say this as we're talking about fiber. You've heard me say it before, and and we played it on a video here. Was it last week that when you played that video, and they were talking about the fact that where did our body get hydrogen before the H2 sticks? Well, our body is supposed to develop hydrogen when we digest fiber. And so here you're talking about fiber, you're talking about people who have constipation, you're talking about the fact that people that have constipation have all of these medical problems. Maybe it's the hydrogen developed from the fiber that actually cures those problems. I mean, start linking two and two together.
Yeah, definitely. Other things that can cause problems is overuse of laxatives can cause a problem, can't it, Curt? If the people are using too many.
Definitely. Yeah.
It can stop. So your body then doesn't know when to go. But, if you increase the fiber and you avoid the foods that are irritating your gut, then, of course, drinking plenty of water is absolutely essential. I mean, if you're going to increase fiber intake, you must increase water intake because the water is needed to, push everything along. And so insufficient water can actually contribute to constipation and gut problems as well. And then, of course, the other thing is medications. Certain medications contribute to constipation, digestion problems. And so if you are taking a medication, you feel that it is causing that, you need to talk to your doctor about possibly using an alternative to alleviate that problem. But it can be a really hard thing for people to get on top of. And it's a big deal, not having your digestion working properly, because like what you just said, it affects your mood. So if things aren't going good down there, probably not going to be in the best mood either.
That's right. You're going to feel crap.
Yeah. And so I just want to finish the call by touching on a few products that I guess they jump to the front of mind if somebody's got issues with trying to get things moving along, suffering from a bit of constipation. I tell you what, the new product that I really love for this is the Sizzle H2 stick, Curt, because I really like the fact that, you're mixing it with 500 mils of water. You're increasing that water intake, but you've also got that magnesium in it. So it really helps to move things along in the bowel. I've had a few people saying to me, they can really feel it detoxing their body. Things are really moving along. So the Sizzle H2 stick is great for that. What do you think about that product?
I think it's great. And then, like I said, you get the benefit of the hydrogen, which is going to neutralize all those toxins that were produced when you were constipated.
Yeah. And then, of course, the other great product we've got, which is the Super Detox. So the Super Detox is actually designed to support the removal of colon plaque and the buildup. And it can also help to support the body to relieve constipation. And, you can follow that as directed. It's a 5-day program with the Super Detox. But I do know people that take, one a day or one every second day. So people, can they do that, Curt?
Right. Yeah, because the Super Detox, if you read the bottle, it says, use it for 7 days, then go off, and then use it again next month to clean out the system. Because you want to purge, and then you want to rebuild, you want to purge, and then you want to rebuild. Okay,
great. And then, of course, the last product I'd chuck in there is the Balance D. Balance D actually contains 6 grams of fiber, and it's a pre and probiotic, so it's going to help restore the gut flora in the bowel, which is really important too.
Yeah. A couple other products I'm just going to throw at you, Katie, that we're talking about this. I really think they would fit in here too in this discussion. One is the Body Shield. It tends to be one of those products that a lot of times people get to talk about, but it's got such high levels of folvates, and the folvates, they pull the toxins out and they push the nutrition in, and it helps to repair that gut lining, helps to zip the cells back together. And that's what happens when you have leaky gut, is that the cells have been pulled apart, and it allows things to leak through. So it helps to sort of zip that back together. And so I like that. And then, of course, I think this is lean too, because isn't there like 12 grams of fiber in there?
There's 6 grams of fiber and 12 grams of protein per serving. So if you have a double scoop, you'll get 12. But it's 6 grams.
Yeah. Okay.
So that's a great one. It's interesting what you just said. You said Body Shield helps with the gut lining. Do you mean that it helps repair leaky gut?
Yeah. So it's gonna help by pulling those toxins out and pushing nutrition into the cells, right? I mean, in your gut lining, if you think of it like a picket fence, right? I'm
Mhm.
trying to give you an analogy that you can picture in your mind. If everybody on the call, if everybody listening to the recording can picture a picket fence, and the closer that you push the pickets together, the closer that you push the rails together, once you get them touching, that's what your gut lining should look like. But because of glyphosate, because of Roundup, Monsanto, and other things like that, even stress in your life, what happens is it becomes a picket fence where you can stick your hand through it.
Right.
And
Wow.
so, I mean, if you guys can picture that in your mind, and so what happens is when you use things like the fulvates that we have in Body Shield, it'll tend to help close that up. It'll close those gaps up because it's helping get rid of inflammation and things like that.
Yeah. And I guess in closing, another important thing I wanted to mention is that bowel cancer is a pretty common type of cancer, and that's why it's really important to have the digestion working properly and alleviate issues with constipation, because that certainly can play a massive role in contributing to developing bowel cancer. And so we really want to keep everything healthy downstairs. So yeah, so hopefully you got some great tips out of this, thought-provoking, maybe motivating even. You might share something we've said or share this video with someone. And yeah, so I really appreciate you joining us today, and I hope you enjoyed the topic. It's a bit of an uncomfortable topic to talk about. I was a bit reluctant when I thought, oh well, it's real and it affects a lot of people. So thanks for joining us today. Thanks, Curt, for joining us. I know you're traveling, and I appreciate you getting on the call.
Thank you, Katie, for hosting this call. Everyone, thanks for joining us.
Thanks, everyone. Bye.
Bye.